La targeted therapy sta diventando di fondamentale importanza nel trattamento del cancro della prostata in fase avanzata. Pochi mesi fa, The Lancet Oncology ha pubblicato i risultati finali di uno studio su una di queste molecole, l'abiraterone, effettuato su pazienti con carcinoma della prostata resistente alla castrazione non sottoposti a precedente chemioterapia. Oggi abbiamo il privilegio di parlare con uno degli autori dello studio, il professore Christopher Logothetis di Houston, che da anni si occupa dello studio del cancro alla prostata. Abbiamo avuto il piacere di incontrarlo a Viterbo durante il congresso Highlights in Prostate Cancer. Professor Logothetis, what kind of study did you conduct, did you perform?
We performed studies to determine if abiraterone acetate worked differently in different people and within the same patient over time, meaning is it better earlier or is it better later? We also conducted studies to determine who was the patient who was going to benefit and who needed therapy in addition to abiraterone acetate.
What are the main clinical data emerging from this research?
The main clinical data emerging from this research is the confirmation that it works better earlier than later. It works better in a subset of patients who have persistent signaling and the prostate cancer has responded to castration by producing its own male hormone, and the evidence that we now know how to select people. Therefore, as a consequence of these studies, we no longer regard prostate cancer as one disease.
Dr. Logothetis, could you synthesize some data that we have obtained in this study regarding survival, mortality, and the use of painkiller?
Yes. The results of the phase 3 and large phase 2 studies are consistent, and they reveal a prolongation of survival, which when given before chemotherapy is even greater than that seen after chemotherapy and extends to 8 months, an improvement in performance status and sense of well-being, and a reduction in the use of analgesics. Furthermore, the synthesis of the results in large phase 2 and phase 3 studies indicate that 70% of patients on average in each of the studies derive clinically significant benefit in all dimensions: survival, improvement in performance status, and reduction in pain, and also that approximately 30% of patients derive no benefit throughout.
In your lecture today, you have shown the importance of understanding the biological pathway in deciding the appropriate therapy based on the progression of the disease. Could you explain better this concept?
So the concept we tried to propose is that there are subsets of patients or timing in the progression of the disease in which each drug will work individually. There are also patients who have complex pathways where combination of drugs are needed. So what these studies have done is showed us that there is great differences between the same patient over time and between patients at the same interval of progression. Understanding how to measure that has allowed us to develop combinations and to now go beyond the anatomic classification of prostate cancer to the biological classification. It must be remembered that the excitement comes from the knowledge that in every solid tumor that we have more than 3 individual agents that prolong survival. When we give them in the right combination at the right time, the potential for a cure exists.
In a review of 2 years ago, you talked about the need of a new classification of prostate cancer following the concept of response to therapy and prostate cancer progression spiral. What does your study suggest in the sequencing model?
One needs to think of prostate cancer like a movie. Until now, we've been looking at one frame of the movie and thinking of this as what we call a vicious cycle. The cancer sends a message to the host in turn sends a message to the cancer, and this reciprocal interaction results in progression. But we realized within the same patient over time, these individual cycles changed and became more complicated. The concept of vicious cycles over time, of course, is a spiral. So understanding how these vicious cycles over time, which is the spiral, changes, will allow us to determine at a given point in time what patient needs precisely what therapy.